Good morning, good afternoon, and good evening to everybody who is joining our event today. My name is Johannes Lin, and I'm a non-resident senior fellow at the Brookings Institution here in Washington, D.C. I serve as co-chair of the Global Community of Practice on Scaling Up Development Outcomes. And today I have the honor and the pleasure to serve as the moderator for today's session on the topic of implications of the COVID-19 crisis for scaling strategies and pathways. So on behalf of the Scaling Community of Practice, I'd like to extend my warm welcome to our 5th annual workshop and to today's session, the first actually of 6 sessions of this year's virtual workshop. We're very sorry that we can't meet you all in person this year, but actually the silver lining of this is that we have a chance to extend our participation to many more of you than probably would have been the case if we'd had this event in person as we have done in the past in the Washington area. We welcome back any of you of our 700 current members of the Community of Practice, and I extend a special welcome to all of you who are new to our community and are with us for the first time. We invite all of you to become or remain active members of the Community of Practice and its working groups. Let me just mention and explain that the Community of Practice is totally voluntary. It's free of charge. It's a resource for anyone interested in joining and to learn and contribute to the question of how we best support scaling up of development and impact. Indeed, it is not just a one-way ticket, so to speak, of learning for each of you and each of us, but it's very much that we share our voices, and the more we do so, I think the stronger the community will be. It is dedicated to learning about and advancing the practice of scaling by learning across sectors, across geographies and perspectives that each of us contribute. In addition to this annual workshop, the Community of Practice issues quarterly newsletters. We've issued 18 so far, and we operate 9 working groups that explore scaling through the lens of various sectors and thematic issues. In fact, today you'll hear from 3 working groups: agriculture, rural development, education, and health. Each of these working groups has quarterly meetings, virtual meetings, and each will have a web page on the Community of Practice's new website, which will be launching on October 30th. Indeed, here you will see the information about this new website. The address is www.scalingcommunityofpractice.com, very straightforward. And indeed, if you want to know more about who we are and what we do, please feel free to reach out to the address, email address you have on the screen in front of you, scalingcop@msi-inc.com. Why don't we leave this up for just one more minute? So if people want to take that down, you can do so. Now, with that as background about who we are as a community of practice, let me now introduce today's session. As I've mentioned already, as of course you know, the topic is implications of the COVID crisis for scaling strategies and pathways. I think we all recognize that this crisis and hopefully its eventual and sooner rather than later recovery presents us all and the world as a whole with a challenge at a global scale. And in fact, a challenge that hasn't been seen in decades and maybe not even centuries. And so clearly, given this huge scale of the challenge, response at scale is required. And so what we'd like to do today is to explore in this session 2 interrelated questions. First, what lessons from our experience as people who've been thinking and acting in scaling, what lessons could we contribute to the global community in their response to the immediate challenges of the crisis? Question 1. Question 2, What lessons are we learning from the response to this large-scale crisis that can help in supporting the recovery after the immediate COVID health crisis has been brought under control? Hopefully within the next, 12 to 18 months, even if not before. Now, to help us address these questions and related matters, we have asked 6 very distinguished panelists to give us their perspectives. And I'd like to briefly introduce them so you know who you will be meeting today. First, there's Julie Howard and Ed Mabaya, who come to us from our Agriculture and Rural Development Working Group. Julie is an independent consultant focusing on food and agriculture system development in sub-Saharan Africa and on related US policies and programs. She is senior advisor in the Global Food Security Program at the Center for Strategic and International Studies at CSIS. And from 2011 to 2014, Julie served as the first chief scientist in the USAID's Bureau for Food Security and also a senior advisor to the USAID Administrator on Agricultural Research, Extension, and Education. Welcome, Julie. Ed Mabaya is a senior research associate in the Department of Global Development at Cornell University, my alma mater. Welcome, Ed, where his teaching, research, and outreach focuses on economic development in Africa. From 2018 through June 2020, Ed was division manager of agribusiness development at the African Development Bank, where he managed continent-wide investments, partnerships, and research in support of ADB's Feed Africa strategy. Now, from the Education Working Group, we have 2 distinguished panelists, Sarah Ruto and Jenny Perlman Robinson. Sarah is the Chief Executive Officer of the People's Action for Learning, or PAL network. This network comprises civil society organizations that conduct citizen-led assessments and actions to improve learning outcomes in Africa, in Asia, and in Latin America. Sarah initiated the citizen-led process in Kenya in 2009, and it currently operates under the name of Uwezo, and she managed the Uwezo East Africa Learning Assessment. She serves on several boards and committees on global education issues. Jenny is a senior fellow with the Center for Universal Education at Brookings, colleague of mine there, where her work focuses on improving education quality in low and middle income countries at large scale. Jenny leads a program on participatory action research for 5 real-time scaling labs in partnership with local institutions in various developing countries. These labs are designed to generate evidence and provide support and guidance for scaling and systems change. Last and definitely not least, from our health working group, we also have 2 colleagues joining us today, Sada Danmusa and Rebecca Lundgren. Sada is the CEO of the Nigerian NGO Midspace DOS Center. He is a physician with postgraduate training in public health and strategy management and has over 20 years health leadership and management experience in Nigeria and in other African countries. Over the years, Sada has successfully led the implementation of several health programs in maternal, newborn and child health, family planning, and HIV/AIDS. In the last 5 years, he has provided strategic support to Nigeria's national and state level governments to plan, deliver, and coordinate reproductive health and family planning programs at scale. And then we have Rebecca Lundgren, who is an applied anthropologist with 30 years of experience in the design, implementation, evaluation, and scale-up of interventions in family planning, adolescent development, gender-based violence prevention, and development of social norms. She works at the Center for Gender Equity and Health at the University of California at San Diego, where she leads the Learning Collaborative to Advance Social Norms. She's also the director of Passages, a project designed to bridge the gap between science and effective policy and practice through research, technical assistance, and catalytic support for scalable normative interventions. I thank all of you, all 6 panelists, for joining us today. It's terrific. As you will have, the audience will have heard, each of you has been a practitioner, researcher, and our practitioner on this question of scaling in the 3 areas specifically that we will be talking about today. Now, let me very briefly say a couple of words about how the flow of our session will develop today. In the first round of comments from the panelists, they will share with us what are the sector-specific lessons for scaling under COVID. In the second round of comments, panelists will share with us what are cross-cutting lessons affecting scaling responses to the COVID crisis and beyond. In other words, lessons that carry over from agriculture or from health and education, possibly to other areas. And of course, finally, we will have time for questions and answers from all of you, the participants, which I will help to direct as appropriate to individual panelists or maybe to the group as a whole. You're free, the participants in the audience are free to submit your questions or comments at any time from now on during the session in the chat box, which you find at the bottom of your screen. Just tap on it and then the chat box will open and you can direct your questions to us here, me as the moderator, and to us, the panelists. And we will then pick up the questions and to the extent time permits, respond to as many as possible. I would also like to mention, just to be sure you're all aware, that we're recording this session and we'll post it on our website when the website opens on October 30. So I think we're ready to start, ready for the first round of comments. And with this, let me turn to Julie. Julie will be followed by Ed, and they will comment on their perspective of impacts and lessons of COVID in agriculture and rural development. Julie, you're on.
Hi, thank you, Johannes. Good morning, everybody. Good evening, good afternoon, wherever you are. Johannes, I'm going to start out by talking about the impact that COVID-19 has had on food and agriculture systems of low-income countries. And I've got 5 points to make. So first, I wanted to start out with a bit of good news. During the last major food price crisis, that was 2007, 2008, probably many of you remember that. It was sort of a perfect storm at that time of tight supplies of cereals and also sort of a number of export bans and border closures that were affected by major producing countries. And so those border closures amplified the impact of the tight supplies and really had a major impact on low-income countries, especially importing countries. So the good news is that hasn't really happened this year. There have been some disruptions, of course, during COVID-19, but by and large, there haven't been these large global supply shortages of cereals. And countries that initially put on export restrictions have withdrawn or time limited them. So helpful to that, and I think also here's one of the lessons. Following 2007, 2008, the international community put into place a better monitoring system. So it was possible to know exactly, who is putting on restrictions and sort of put in international pressure at that time. So I think that's been a very, very good advancement. So we haven't had this sort of disruption of large international flows of staples, but instead a different kind of issue has arisen during COVID-19. So COVID-19 has really exposed the fragilities of domestic food systems. So the transportation and economic restrictions that have affected all of us have disrupted food systems in a major way. When we think about in low-income countries, 80% of consumers in low-income countries rely on markets for food supplies. So the lockdown measures and business closures have affected the movement of commodities from farmers to consumers and all along the value chain. So we think about not only farmers, but also the folks who are marketing their produce, bringing it to markets, or processing it or producing. So that movement has really been affected by COVID, and the very dense urban and peri-urban areas have been hit the hardest. Among the supply chains, it's been the most labor-intensive parts of the food system and the labor-intensive commodities. So we think of fruits and vegetables, we think of animal source foods. Those have been affected more than other supply chains, and also the off-farm sector. So transportation, marketing, processing, all the way to food service, restaurants, food delivery. Those have been the most severely affected. So a major disruption, but different in character than what we saw in 2007, 2008. Okay, my third point is that the job and income losses economy-wide that we're all aware of also diminished the food purchasing power of many households and affected their ability to buy food and other necessities. And so the poorest were and are the hardest hit in this situation. And what we've learned is that where social protection programs existed before, or where they could be readily expanded, we think of places like India, this helped arrest or diminish some of those impacts. But those sorts of social protection programs are still relatively rare in low-income countries. Fourth point is that COVID-19 has revealed the key role that the private sector plays in agriculture and food. In low-income countries, though, the private sector is mostly informal and small and medium-scale businesses. They provide the great majority of production. Small farms are also small businesses, but they're also providing the processing and marketing and food services all the way through to restaurants and street food vendors. So the impact of the economic and transportation shutdowns has fallen especially heavily on these actors that are providing the majority of services in food systems. So many of these businesses have had to very quickly pivot their business models, and we see that, of course, in the US. We've seen restaurants having to pivot from in-person seating to delivery and takeout. But you think in low-income countries, what do you need? You need finance, you need resources to make that kind of pivot. But the small, medium, informal businesses, these are businesses that in normal times have great difficulty accessing finance through banks and large institutions, or oftentimes accessing resources through government programs. So pre-pandemic, donors and governments had begun to focus on programs that would provide more financial resources and capacity building to this group of small and medium scale enterprises, but they still reach relatively few. My last point before turning over to Ed is that COVID-19 disruptions have had quite a negative impact on nutrition. And here there's, of course, a crossover effect with health. Supply chains for fruits and vegetables, as I mentioned, animal sourced foods and nutritious foods are relatively labor intensive. So these have been cut and disrupted. So the prices of those nutritious foods, they were already higher, than staple foods, than rice, than wheat, than maize. And because of COVID, their prices now have risen even more and made them even more inaccessible. So consumers, especially poor consumers, have had to shift their buying to a majority of cheaper staples. In addition, nutrition programming that was so important for the poor and vulnerable, school feeding programs, mother and infant feeding programs, those have been interrupted. So let me close there, Johannes. Those are the 5 key impacts I think we see of food and agricultural systems of the COVID crisis.
Thank you very much, Julie. And Ed, it's your turn now. Ed.
Thank you very much, Julie, for setting that up. I was actually manager at the African Development Bank when COVID-19 was declared a global pandemic. Beyond the immediate efforts to contain the pandemic from a public health standpoint, the second highest priority for most African governments was ensuring that vulnerable communities do not starve. I'll share with you 4 key lessons from my experience that are mostly from sub-Saharan Africa, but maybe generalizable to other low-income countries. So the first one, was probably most eloquently put by Charles Darwin when he said, "It is not the strongest species that survives, nor the most intelligent that survives. It is the one that is most adaptable to change." See, when the pandemic hit in Q2 of this year, almost all institutions had made up their annual work plans and established budgets for the rest of the year. Most agricultural scaling up projects were caught off guard by this pandemic. From the excellent Scaling Up Sourcebook that I encourage all of you to take a look at, we had checked all the boxes when it came to the 3-step framework for scaling up, the 4 dimensions of scalability, the 10-point scaling ingredients. But when COVID-19 came, it threw a wrench into these plans, and every scaling up project needed to be COVIDized, as they said then. The lesson from that was, some projects seem to be able to adapt and manage this kind of change, and others were caught completely off guard and could not manage and adapt. The lesson here is that in designing scaling up projects in agriculture, we should always design them to anticipate and withstand shocks that may come from civil unrest, extreme weather, pests and diseases. All these changes are going to become the new constant now. The second lesson is, Julie alluded to this a little bit earlier on, was this very obvious need that has come up, the need to orient scaling up projects in agriculture from just enhancing agricultural productivity to building resilient agri-food systems. More and more, it is emerging from core themes as declared at AGRF, the African Union Ministers' response to COVID, and recently released Foresight report and conversations that are going on in the building of the UN Food System Summit. There seems to be a growing agreement here that moving forward, agri-food systems need to go beyond solving the production problem and challenges towards increasing the delivery of affordable, accessible, and nutritious food. I must admit I'm coming from that camp where I thought, let's get production first and the rest will take care of it. But it became very obvious as soon as COVID hit in April of this year, we did not have to wait one season to see the impact on food access. They were very immediate and they did not have to wait for harvest. So the lesson here is that all scalable technologies in agriculture need to be contextualized in a broader agri-food systems that spans from fork to farm. No longer do we have the luxury of just focusing on production. The third lesson for me was that the critical role that is played by the small and medium enterprises in scaling up the deployment of technologies. COVID-19 has made clear the vital role of SMEs in delivering information, products, services to scale and fostering resilience in agri-food systems. I'm glad that key institutions such as USAID, AFDB, AGRA, and everybody else is doubling down on this role that SMEs, on the assistance to SMEs. Greater efforts to improve SME access to finance, policy improvements and investments in such areas as roads, wholesale markets are still needed. All scaling up models must have, from the beginning, be designed to have a value proposition for SMEs to close the last mile to both farmers and consumers. Let me close on a positive note, a good lesson. And that is that you've all heard this saying before, do not let a good crisis go to waste. Indeed, COVID-19 has thrown a lot of challenges across different sectors, but there's some initiatives that were well aligned to address some of the constraints that were imposed by the COVID-19 pandemic. A good example of this is the rapid acceleration of digital solutions across African agriculture. We'll speak more to this point in the next round of cross-cutting themes. Other scale-up opportunities include agricultural input subsidy programs that were rolled out by many African governments in response to this pandemic. COVID-19 has highlighted key problems and challenges in the current food systems, but at the same time, all these scalable solutions that we have that are coming from private sector, from donor community and NGOs, and there is some solutions that can address some of these key problems. And now more than ever, governments, development finance institutions, donors are very keen to listen to address these kind of challenges. So if and when we have those kind of possible solutions to problems, they have a key potential to be scaled up very rapidly and deployed to scale. Thank you. I'll leave it at that.
Thank you, Ed, and thank you to both panelists. You've been remarkably disciplined in staying in time. That's wonderful. Thank you. Ed, I don't know whether it's possible, but perhaps with the help of our tech group, you could put up, you referred to the 3-step framework. If there's a link you can put up in the chat box for our audience to access that 3-step framework. I know what you're referring to, but I'm not sure everybody else does.
I will do that. I'll post the link to the book, the Scale Up SaaS book.
That's great. Thanks. If that's possible, that'd be wonderful. Anyway, it's now time to turn to education. Jenny, it's your turn. Go ahead.
Great, thanks Johannes, and good morning, good afternoon, good evening. On behalf of the Education Working Group, I just want to say a big thank you to the organizers, in particular to Johannes Lin and Larry Cooley and Natalie Kalengo and the whole global event management team for putting on this very large production over the next 2 weeks. I think we have some great panels and events in store for us over the next 14 days. And personally, I was very excited to participate in this plenary panel because I find one of the real benefits of this community of practice is the opportunity to share and exchange across sectors. So this is just a fantastic opportunity, and delighted to be joined by my fellow panelists, and in particular, my Education Working Group panelist, Sarah Ruutu, who we'll hear from shortly during the panel discussion. So I'm going to just spend a few minutes sharing some of the impact that we're seeing of the global pandemic on education around the world to set the stage, and then conclude with sharing some of the potential lessons emerging for scaling that we're seeing as well. So in terms of the impact, I think, everyone probably participating in this discussion can attest to that COVID-19 has had and will continue to have far-reaching impacts on education systems around the world. And I'll just mention a few ways that they're having this impact now and into the future. The first is around interrupted learning. At the height of the outbreak this spring, we had 192 countries close their schools, sending home 1.6 billion children. That's 91% of all students in the world were home. And when I was looking at the numbers on Friday, 9 months later, there are still more than 500 million children who are affected by school closures. And in 34 countries, you have countrywide closures, and many more countries with partial school closures around the world. So even before COVID, we faced a learning crisis. With 53% of children in low and middle income countries unable to read and understand simple text by the age of 10. So that was sort of in quote unquote normal times. So certainly without significant remedial action, there's going to be really substantial setbacks in our goals to address this learning crisis. The second impact we're seeing is on increased school dropouts and the real concern and risk that millions won't ever return back to school. By some estimates, there are an estimated 24 million children who will drop out of school due to COVID, and those are certainly those who are living in some of the most marginalized, remote, and disadvantaged communities. Which leads to the third impact, is how COVID has really exacerbated existing inequities in terms of access to and the quality of education. We've seen that poor households around the world are much less likely able to cope with the impact of the pandemic, and we really see disproportionate challenges for girls living in remote and in poorer households, for children who are displaced, as well as children living with disabilities. And we know that remote instruction that so many countries have had to turn to and rely on have failed to reach hundreds of millions of learners. There was a recent joint UNESCO, UNICEF, and World Bank survey that found that at least 463 million children in low and middle income countries are not being reached at all by any kind of remote instruction. The fourth impact, and this is some links to the previous speakers, is the interruption to school feeding, which we know is vital for so many children who rely on that daily meal. The current situation, there's more than 300 million children who are missing out on school meals globally. One of the fifth impacts we're seeing is an increase of child protection risks as a result of kids being out of school. Millions of kids are at risk of being pushed into child labor. There's a fear that we might actually see numbers increase in the first time in 20 years in terms of the progress that's been made, as well as we're seeing forced marriages for girls and child trafficking on the rise in some regions around the world. 6 is a lack of access to essential social services that we know schools provide, whether that's around mental health or psychosocial support. Again, might be some linkages to our next speakers talking about some of the health implications. And 7, certainly the spillover effect that we're seeing of children being out of school in terms of contributing to the economic hardships that so many families are facing already around the world. The immediate impact is a recognition of parents and families, caregivers being unable to work outside the home with children now home, but also in terms of the longer term implications. It's by one estimate, 1 lost year of school can translate to a loss of 7 to 10% of lifetime income for a child, 7 to 10% over their lifetime. And finally, we can anticipate that there will be less money overall for education. We were already facing a significant financing gap globally when it comes to education needs. And now we're facing economic contraction as a result of the pandemic, increased pressures on public budgets and households, and a recognition that many resources will be directed to other vital services, such as health, such as food security, which will be desperately needed, but also at the detriment to education at a time where needs are perhaps even greatest. By pre-COVID estimates, we were already facing a $148 billion annual financing gap in order to meet the Sustainable Development Goals, our global commitment to lifelong learning for all by 2030. And it's estimated as a result of COVID, that financing gap could increase by 1/3 each year. So not necessarily a great picture, quite bleak, I know, but what does this mean going forward? Switching to Johannes' second question about what are some of the scaling implications or lessons. You know, there's been lots of talk about how are we thinking about building back better? How are we thinking about building back more equitably, greener, and so forth? And what are some of these lessons for scaling in response to this crisis and disruption we can certainly expect to some extent in the future? And at the Center for Universal Education at Brookings, our team has been particularly struck by some of the key scaling principles that we've been exploring with partners in global action research that we've been undertaking in these real-time scaling labs. And these principles appear to be quite relevant in responding to the pandemic currently and certainly in the future. So I'm going to very briefly mention 4 of those. The first relates to Ed's previous point about the need to be adaptive, that those most adaptable survive, as he said. And here is really a recognition that we've seen the need to be iterative, flexible, and adaptive in the approaches to respond to the COVID pandemic. And I know this will be a theme that we'll be discussing on future panels this week as well. So as countries, as ministries of education and communities are racing to respond to the pandemic, there's a real critical importance to continuously assess and reflect and course correct based on timely data and a rapidly evolving context. We know that this type of flexibility and adaptive capacity is absolutely critical in scaling and successful and sustainable scaling, but it's particularly crucial at a time when events are unfolding so rapidly. So just to give a quick example, in Jordan, one of our partners, INJAZ, is working with the Ministry of Education and had planned to introduce online digital delivery of financial education for all secondary school students. And now with COVID, they've really seized this sort of opportunity, if you will, to pivot and place all of the financial education content online for grades 11 and 12. And I think this flexibility also relates to financing. And I hope this is a topic we'll address on the panel shortly. And really the need to rethink about how we can ensure that our financing mechanisms are flexible and responsive and able to pivot and adapt to the crisis and the evolving needs. The second implication is this need to engage new education allies and partners. While the crisis has certainly underscored the essential role of the government in preparing and responding to the pandemic, it's also really broadened the sort of learning ecosystem, the tent of who can and should be involved in children's learning. And for better or for worse, we're seeing parents and caregivers being thrust into the role of teachers. And I think the challenge for us all is how do we really capitalize on that engagement and really ensure that in the right way that this type of expanding those who can be involved in the teaching process, not to replace teachers or schools, but to certainly complement children's learning. I know I'm getting short on time, but just to quickly say in Botswana, well, maybe I'll share this example for the panel about what's happening in Botswana. Third, I would say a real lesson emerging is a need to really double down on knowledge sharing and peer exchange. Again, I think it speaks to the critical importance of learning networks such as this community of practice. You know, in some ways, COVID has really shown a common cause of all countries and different socioeconomic strata in terms of responding to a crisis that's affecting all, albeit in different ways. High-income countries certainly have a lot to learn from lower-income countries that have faced massive disruption to education in the past due to displacement and crisis. And at this point, it's really critical that we're building on what we've learned in existing efforts. So what has worked, what's not worked, what's currently working, and how we best share to ensure that we're not reinventing wheels. So again, if ever there was a time to learn from one another and avoid repeating mistakes, now's the time. And finally, I'll just conclude with this appreciation of the fourth implication that we're seeing and lesson is this appreciation of a broader enabling environment. I think, you know, in response to this pandemic, there's a tendency to rush and try to identify the next, you know, great app, the next technological gadget. And we certainly know in education that ed tech can serve as a complement, but it certainly cannot be a replacement for schools and for teachers. But we're learning a lot about what it looks like if it's done appropriately, and there's a real opportunity here. I think COVID has certainly laid bare to the vast inequities that exist, and in particular in terms of the stark digital divide. So any large-scale response to COVID, really we have to understand the broader system, those policies, the infrastructure, the power dynamics and the norms and how that might hinder or enable scaling. So let me finish there, Johannes. I see you're popping up on the screen. I'll just conclude by saying something similar to what Ed said, that, you know, while it certainly shouldn't take a crisis to spur us all into action and sort of, you know, see this sort of large-scale transformational change we want to see. If ever there was a leapfrog moment in education, many of us believe that now is the time. And so it's really an opportunity to rethink how and who and what learning can look like for everyone.
Thank you. Great, Jenny. Leapfrog moment. I'll put that down as for my closing comments. Finally, a third, I should say, not finally, but third, we now turn to the health sector, which after all is where in a way it all started, right? So Sada, you're in the front line there in Nigeria, and we really look forward to hearing from you and your perspective, maybe from Nigeria, but also from more broadly Africa and beyond. So please, Sada, it's your turn.
Yeah, thank you very much, Johan. Can you hear me?
Yes, we hear you very well.
Right. So thank you very much. I'm going to be speaking specifically about Nigeria on this session, but I can expand to Africa on the next session. So I'll be speaking specifically on our experience in supporting government to scale up, because that is what I lead at the technical support unit, which supports the ministry, as you explained in your introduction. And now a bit of a background, you know, I will talk about a context, then what our observations are, and then what we did and what's really the learning combined. So basically what we see at the context is that in Nigeria, the supporting scale up through the public sector, which we do, is really very challenging. Basically because, not just because we're a very large country of close to 200 million, but also divided into about 774 local governments that are similar to districts. But, you know, of more importance is the fact that we have been going through a kind of decentralization that has become kind of indistinct. And that has led to a lot of challenges, coordination, a lot of duplication of effort, and a lot of not knowing which role, which level plays. And then that also complicates, you know, ownership, local ownership that is important in scaling up. But added to this is also the well-documented lack of data in Nigeria, which really is a very big issue for planning. So despite what the government is doing, there is a lot of challenge, and we do know that the public sector is really reputed for very poor delivery in many analyses and in many write-ups. So COVID-19 further aggravated this situation. But I think for us, importantly, it also provides an important lesson that will support scale-up activities both in Nigeria now, but in other countries and in the post-COVID era. So in looking at how we support scale-up, I would want to say that there are two things that we defined. One of them is the fact that we could support scale-up by supporting actual expansion of services geographically, sort of providing money for additional training of health workers, providing commodities. But there is also another one, which is really building capacity for the government to really be able to conduct that process of expansion and maintain it. Basically, the talk of the adaptive capacity, and that is really where we are working. So our observation, or my observations, would be really around with that perspective. So in terms of what we see with the COVID situation for supporting scale-up, we look at it from three different levels. One of them is at the front line where services are provided. The second is at the ministry or the managerial level where administrative decisions are taken. And that is really where we exert our own influence. The other one is at the higher policy level, which really talk about the decision on financing and all of those very high level policies. So basically, I will talk about this last one in the next session, and I will touch a bit on the first one, but my concentration is more on the where we operate, that is at the ministry level. So at the front line, generally we see that there is a lot of services decline, a lot of reduction in service provision, and this affect significantly all services. I mean, some might be more affected by the others, but we generally see a significant drop from the data. And all channels, private, public, they are all affected. Of course, very few differently, like what you have on the very rural areas, the patent medical vendors, they were affected initially, but not as much as the others, but obviously there was an affectation. An important thing we also see is the fact that most of the reasons for this decline really has to do with the supply side. So when you look at the demand for health by patients, when you talk with local workers, when you talk with the local managers, what you hear more is that it is more of rejection of patients by providers, basically because they know the effect, but importantly is there is a widespread lack of personal protective equipment, which made them not to be providing services. Now, another thing we see at that level is also lack of services due to obviously lockdown and the restriction that imposed, but also supply chain challenges, especially the last mile delivery. So these are really what we see at that level. But at the ministry level where we operate and where administrative decisions often take place, we see three key things that affected how we support scale-up. One of them is that there are policies that we call catalytic policies in terms of the fact that we feel they support scale-up, they have the best opportunity or the best chance of scaling interventions. Something like the tax shifting policy, which rely on training more and more lower level healthcare workers. What we saw during COVID was that completely or almost completely stopped. And then you will see that going back, you will have to go back and start advocating with local governments to start that up. Another example is the family planning cluster implementation plan, which the thinking at the country level is that for the country to make any serious move, any serious mileage towards achieving its contraceptive prevalence rate, states will have to have their plan and adopt to the strategies that the national government identified, of course, adapting them to their context. We've been following that and supporting the federal government and the state government to be tracking that. But of course, during COVID, everything changed. Now, why I mentioned some of those policies is because we see them as catalytic just beyond what they are aiming at. But there has been a lot of process to get them moving. But then the COVID situation almost kind of reversed the process, or at best told the process that we will have to go back on them. But more directly, there are also operational processes that were stopped, which really directly cause a lot of problem that we see at the service delivery level. For example, the supply chain that rely on the officers coming to determine what goes where and what distant area will have to be reached, almost also stopped. Of course, there are other things, other tracking things that are being done, like where training is taking place, where do we need to get data. All of those really slowed the service provision. I think of importance also coming to, toward the kind of work we do. The work office difficulties that the government officials face, because they had a lot of challenges moving to the new normal. When I say the new normal is with the COVID lockdown, with even after releasing the lockdown with social distancing and a lot of policies and guidelines in terms of how many people will be in a room to meet. They will have to be meeting remotely. And yet a lot of them are not very much used to that, basically because up to the point of the COVID crisis, most ministries are really more paper-based than electronic. And, just to say, just before that, email, and I believe up to now, email is not an official communication with most ministries. So even when they use it very commonly, you hardly can take official action with it until you get a hard copy. Of course, those things are changing positively because of COVID, but that was the situation. And now at the higher level, which I said I will discuss later, we really just see effect because of the decrease in, in the resources that the country has. So just quickly, let me speak about what we did and what lessons are there. So what we did was to sit down with the government and say, fine, in the processes that we're supporting, let's identify what are those key priority areas that will support you to move within this crisis period. One area that we support them, so we have 3 key areas. One area is we support them in technical delivery, which is more like leadership and managerial support for planning day-to-day activities. So we saw that it's affected significantly, and we decided with them that to ensure delivery, we need to expedite that move from paper-based to electronic work so that they can continue their daily day-to-day work, meeting within themselves and meeting with partners and being able to do that. And we supported them to get that capacity, engage a consultant. But I think an important lesson is that even though that was a need, bureaucratic processes at the government made it a little bit difficult for them to mobilize until we were really able to get the donor to agree to mobilize some resources for us to support them. And that is one key lesson, what we see from the donors in terms of their ability to be flexible and support that, which I think is an opportunity that we need to take and when crises like this happen. So the other area is in terms of coordination. So we supported the government, or we discussed with the government on the need to have a plan to be able to make sure that other than COVID services or COVID response, other services are continuing. So basically, following the World Health Organization guidelines, we supported engagement with partners, engagement with other government at other government levels, and then within the same level of government to make sure that there's a coordinated action. That might sound really straightforward, but looking at the fact that coming into that crisis, there's a lot of uncertainty in terms of what action and who is doing what. That coordination was really very, very critical to get them to lead the process. Another thing, the third thing we support them traditionally has been how they use data, to get evidence-based decisions. Basically, what we look at when we sat down with them to agree on this is that what we have is an opportunity. We're meeting with subnational governments, we're meeting with lower governments on a quarterly basis to look at the data and to improve how data is used in decision making. So we were able to get agreement that this should also include COVID-19 data and COVID-19 responses and how other services are progressing within, within the COVID-19 crisis. So just quickly within the 10 minutes, this is what I have, but I'm ready to provide additional updates if it's needed or respond to questions. Thank you very much, and over.
Thank you, Sada. That was a very comprehensive picture that you generated for us on the situation in Nigeria and how you're approaching it, and especially your comments at the end about response were very helpful. So having now talked about the impact in the three sectors that were covered, it's now time to actually explore some of the cross-cutting issues that arise when you try to scale the response to this crisis and beyond, very importantly. In our preparatory discussions that we had among the panelists, we actually identified 6 potential areas where such cross-cutting channels can be particularly relevant and where lessons might have arisen from the 3 sectors that we're particularly focusing on today. The 6 areas, not necessarily all of them covered to be covered, but potentially relevant, and maybe others the panelists may want to talk about. First of all, the role of digitalization. We already heard a bit about that. Competition for public budgets. Again, we already touched briefly on that. The role of the private sector. The role of the international community. Are we doing enough from as donors? And finally, 2 specific areas that I asked to also have us focus on, namely the impact on women. That's clearly an issue, say, in this country, in the US, where women are particularly affected, but I'm sure it's even maybe more so in developing countries. And the impact on the most vulnerable, which we probably need to pay special attention to. So with these 6 cross-cutting areas, but maybe others, let me turn back to start in a bit of reverse order now and ask Rebecca Lundgren from the health side again to continue perhaps where Sada left off and tell us your perspective, Rebecca, on how you see and how you would identify key cross-cutting issues. You will be followed again by Sada. Sada, if I could ask you in your follow-up comments to Rebecca to be really quite short, because we're already running over a bit on our timetable. I want to make sure we leave enough time for questions at the end. So, Rebecca, word is yours.
Thank you, Johannes. Thank you all to all my panelists and to all of you here on the call today. I'm really honored to be here, and I want to speak a little bit about my reflections providing technical assistance and support to scale up, over the last year during the time of COVID. And I think my thoughts, they of course echo a lot of what my colleagues have said, especially Ed's comments about adaptation and resilience and how we're responding, and using this as a key moment to push Scale Up forward in new ways that we might not have been thinking about before. So I've been working on some Scale Up initiatives in Uganda and DRC and Nigeria, but I'm going to focus a little bit on my work in Uganda today. So I think, you know, this is just a different time, and I feel very differently about the way that myself and my colleagues are supporting these Scale Up initiatives. You know, I think obviously the fact that all of our work is virtual and you're not able to go to a country and lead Scale Up workshops and support in person is part of it. But also I think there's very much an increased recognition of vulnerabilities. So data showing increased violence against children and violence against women, more health disparities, has really prompted a lot of multisectoral focus and passion around those topics that, you know, weren't necessarily there before. And the Scale Up work in Uganda I'm sharing is related to violence against children and violence against women. So there's been a lot of traction around on Scale Up because of such a felt need. There's also, as Jenny said, a real sense of a common cause where there's no leader here. You know, we're all in it. Every country's trying to figure it out. You know, there's definitely a sense that, you know, the United States in particular doesn't have all the answers, and that we need, you know, countries need to be more self-reliant, and, you know, our role really is more of taking a back seat. And the other thing I feel is different, which is really supporting Scale Up work, is this focus on adaptation and learning. We all know that everything is new that we're doing. We have to learn from it. We have to adapt, you know, so very focused on sort of creating learning communities. So that leads me to, you know, there's two areas that I think are really exciting and interesting around providing support to Scale Up. One is what I call the democratization of Scale Up, and also increased government ownership. And secondly, I'd like to talk a little bit about digitalization and the virtual nature of technical assistance and interventions. So what I found is, due to the fact that all of our work is, you know, virtual, it's just a lot easier to include more voices. We don't have to be, you know, we're more inclusive. It's easier to engage individuals at national, regional, and local levels, and especially even technical experts from outside of countries, because we're not, you know, counting the pennies and trying to figure out how many seats do we have at the table. So, you know, some recent workshops in Uganda, we were able to bring together, you know, all of those different levels of the government, NGOs, and some folks who were really experts in the interventions that were being scaled from even outside of Uganda. So I think that's really exciting. It also makes it easier for us to engage different levels of the government. So working, for example, in northern Uganda, it was always difficult to get the central level engaged because of the distance and the cost of travel. So speaking about government engagement is even more, you know, essential than it ever was, because you can't really hold a meeting or have an activity due to, you know, some of the restrictions for travel and meetings without government approval and involvement. So I think there's been a lot more government front and center in the activities that I'm working in, and I think that will be sustained going forward. And the other thing I've noticed about government involvement is that there's a little more space to work on what we call vertical scale up or institutionalization, because some parts of the government are really able to think at that level while the activities on the ground are shifting a bit. So the other really important area I want to mention is sort of this focus. I feel like the Scale Up community that's supporting, you know, that's providing technical assistance is focusing a lot more on capacity strengthening through accompaniment, through providing formats and structures. You know, I just recently had the experience where we had a Scale Up workshop in Uganda. One was all virtual, and the second one, my Ugandan partners were in person, and I, of course, couldn't go there and support. But I think it really, in many ways, it was a positive thing. It made me approach the relationship differently, give a lot stronger focus on sort of the strengthening and the supporting the team, knowing that I wouldn't be there. So I think that's a really great thing, because what we really need to support, you know, our goal, which is achieving expanding tested interventions to have broad and sustained impact, is this sort of increase in adaptive capacity and scale-up capacity. So the other topic I wanted to discuss a little bit is digitalization. So, you know, it's now normal for, like, our scale-up work in Uganda and also in Rwanda and DRC, for a lot of this work to be virtual. it did require intensive support initially, but now we've seen that the government has definitely improved the virtual communication, and business is conducted virtually at all levels, even at the district level, which I thought was not going to be possible. So that's exciting and opens a lot of opportunities. The virtual or the digitalization of meetings and workshops was slow initially, but I think it has scaled now. But it did require, there are some learnings we had from that. Definitely a lot of capacity building needed to make sure that our partners and folks who were maybe working at home had the computers, the hotspots, the capacity to connect virtually. And then we also found that just because you're not bringing people together maybe in meetings, so you're not providing per diem, you can still provide per diem, virtual per diem. So we found it was very helpful to give people funds for airtime, to pay for an internet cafe, et cetera. And that was sort of a new way of working that we're dealing. Of course, use of different kinds of applications. WhatsApp is sometimes, the most functional in some country settings because of bandwidth. And then another thing I found very interesting is sort of this learning to master this online-offline continuum. So you can't just take a meeting or a workshop, a 3-day workshop, and say, okay, we're going to be online for 3 days, obviously. So now we've adapted it to really think about, when are we together online? When are we offline? When are people working individually? When are they working in partners? Can they have some small meetings? Can we mail materials or courier materials to them so they have them at their home? So all those different ways that we can work together, and in some ways it's been very beneficial because I'm sure we've all been in meetings where we're stuck because the right person is not in the meeting. We don't have that ministries person or that decision maker. But now we have the opportunity to go back and make sure they're engaged, do some of that homework and get those people on board to move forward the scaling up sort of commitments that we need to make. I guess my last point on that really is active facilitation is really important in those meetings. And just like it would in person, it takes a team to be able to monitor the chat box, to do the polls, to get people engaged and not just sort of staring at the screen. And use of virtual meeting techniques like, Jamboard and whiteboards and breakout sessions and Google Docs. But my one caution there, as someone who's on the older side of the continuum, is we have to be careful about inequities due to age and connectivity. So, sometimes meetings and electronic communication can move really fast and leave some people behind who can't just kind of master all of the bells and whistles as quickly. So my final point is just something that's been mentioned a few times already, especially by my education colleagues, the interesting shift in interventions. As mentioned in my introduction, I work a lot in social norms work. And now we're not really able to implement group-based intervention, which was a lot of the work I was supporting was group-based. So there's definitely an increased appreciation of the role of media, social media, television, radio, and ways to do sort of that norms reflection and education differently. An example I like to share is working by Save the Children that I'm supporting in Uganda, where it was an in-person school-based intervention to prevent violence against children perpetrated by teachers. So that whole intervention has moved online to WhatsApp and Facebook, where they're sort of engaging, over 1,000 teachers now in sort of robust dialogue about norms related to violence and sexual harassment in school. So I think, a lot of exciting opportunities there, new ways of connecting, new ways of thinking about technical assistance, new type ways of reaching communities, greater emphasis on adaptation and learning and support for each other. So with that, I will turn it over to Johannes and then to Dr. Sada.
Thank you very much, Rebecca. That was great. We all have to find new ways of doing business. And those of us who are a bit older, I guess, have to learn new tricks. Anyway, Sada, maybe 1 or 2 comments. We're running a bit short of time. So if you could give us your highlights. Go ahead.
Right. Thank you very much, Johannes. And I think Rebecca really has covered a lot of things that I may have said, so we could save time. But I think I'll just concentrate on the government engagement. And I think that is really very, very important thing to say. So when we had this problem at the very high policy level, we see that for Nigeria depends on singularly on oil. decrease in oil price and decrease in the volume of oil that is being sold brought a lot of issues because of COVID relationship with how we were able to get money to the states significantly decreased, and then budget has to be revised, and the naira has to be devalued. So generally, there is significant economic impact. Now, what the government did was initially reduce the budget, but generally across board, and then we just saw for the next 2021 budget, there is significant increase to health. Although the devaluation of naira will reduce it, we still see that this is direct effect of seeing COVID and how devastating it could be, and more attention has come to health again. While a lot of decrease in these resources has affected a lot of very important influential policies like our National Health Act, which with the Basic Healthcare Provision Fund that is intended to both purchase services and pay for, and provide money for providers. We just see that overall, with those things, we still have a lot of opportunities to improve the healthcare system because of this particular situation. In most states, we saw there have been massive increase in infrastructural upgrades. Hospitals were improved. There are a lot of equipment that has been bought basically in response to this. And we see that health workers are getting better and better rewarded because of this. And we feel that this is, as much as it is a very, very devastating situation, a crisis, it comes with its own opportunities. And I think what is key in terms of the call to action is really at any particular situation, as I think Ed mentioned, we look at it as an opportunity to really engage more with the government, because this is a situation where to make the government see health as a very, very critical issue, that we could get improvement in the health system, and we could use that opportunity to scale up services beyond what earlier advocacy had not been able to do for us. So I think I will stop here in the interest of time. And thank you very much, Johannes, and everyone among the panelists. Thank you.
Thank you, Sada. That's actually fascinating that you find that the crisis has, in some ways, helped you push resources into the direction where you feel they needed to go anyway. So thank you. That's interesting. Now, we'll hear from colleagues who may find the opposite has happened to them or to their sector anyway. I now turn to Julie and Ed, and would like to actually have you talk briefly from your perspective about your how you see the education situation. Thank you, Julie.
Agriculture situation.
Agriculture, sorry. Why did agriculture, of course.
It's of course very connected to both the health and education sectors. Thank you,
right.
Johannes. So
Thank
I'm
you, Julie.
going to spend just a minute deepening a point that Ed started, sort of on a changing way that we're perceiving the challenge now in food and agriculture systems. And then I've got like 5 very short bullet points, and we referred to a lot of these already, so I'll just touch on those briefly. So I just wanted to talk for a minute about why it's particularly important to think about scaling for food and agricultural system and the lessons from COVID at this moment in time. Because food and agriculture systems, underscoring Ed's point, really at a crossroads with issues thrown into even sharper relief as a result of the COVID crisis. So why is that? Well, for the last 50 years, the global focus of food system policies and programs has really been on scaling up the production of a handful of staple grain commodities: rice, maize, wheat, and cassava. And this responded to our good understanding back in the 60s and 70s of what constituted hunger and what was the major issue to address. And that is hunger from calorie deficits. So increase the production of staples to meet the need for calories. But there have been several sort of unintended impacts that have unfolded over the decades, particularly apparent now. First, the evidence that we have suggests that this goal of making staple foods relatively less expensive, using the best science available then, has inadvertently contributed to less diversity in agricultural systems and to a food environment that's now not able to provide an adequate variety of affordable, safe, and nutrient-dense foods. So what does this mean? It really means we now have data coming in. 3/4 of people on the African continent, 3/4 cannot afford a healthy diet. 3 billion people worldwide cannot afford a healthy diet. And globally, and I always find this stunning every time I read about it, poor diets are now the leading contributor to the global burden of disease. So these are negative health effects from calorie deficits, still from undernutrition in some parts of the world, but also from micronutrient deficiencies and overnutrition issues, obesity and uptake of diabetes and all the things our health colleagues can tell us about. So there's that issue. We have sort of really narrowed down the diversity. That's an issue to deal with. So as Ed mentioned, current agricultural systems are also being challenged rapidly to adapt to climate change. Increasing temperatures are reducing yields, shifting seasonal rainfall patterns. We're seeing increasing frequency of drought and flooding. So that's an issue, but it's not only that agricultural practices in the system have to adapt to climate change, but agricultural systems themselves have to change to help mitigate agriculture's impact on climate. So agricultural production, especially in advanced systems, generates greenhouse gas emissions through land use, livestock production, and the use of energy-intensive inputs. And finally, agriculture's consumption of natural resources is too inefficient now. It's pushing us past the limits of planetary sustainability. This is, especially in Africa, the focus on expanding land to expand production, deteriorating soil quality, the loss of biodiversity, the contamination of waterways and air and advanced systems through excess nutrient runoff. So available research and analyses are converging around this urgent need to strike a better balance between sustaining the natural resource base, producing food, and improving people's access to nutritious diets. So as the COVID response continues over the next couple of years, it can help lay the groundwork for either broader systems change at this magnitude, or it can cement in and possibly exacerbate some of the existing inequities and some of the issues I just laid out. So I'm raising these issues at our conference on scaling because the changes that are needed and which have been brought out so clearly during these past few months really can't be addressed with an incremental approach. Bold public sector, private sector, and civil society vision, collaboration, and action are going to be needed for a reset, and it is a reset of our food and agricultural systems. So scaling, the idea of change at the systems level, collaboration across sectors, key drivers and tools for scaling are all incredibly relevant. So I see the challenge for food and agricultural system transformation is to move away from our current scaling model and its dominant focus on homogeneous systems, which are often centralized, large scale, often mechanized, and move away from the production of staple crops, such a heavy focus on staple crops. We need to move to a much more diversified, local-centric, and inclusive approach that supports an array of diverse food systems and enterprises. So let me get to those 5 bullet points, and this will be easy because my other panelists have mentioned so many of them. So the importance of digital applications and data. It's really hard to overestimate the effect that COVID has had on accelerating the uptake of digital technologies. I think we were on a very slow path that's now going at warp speed. So, and also, incredibly bright spot, the rapid expansion of the use and sharing of data, Sada was mentioning, and the other colleagues. So there's enormous excitement about the rapid expansion of these tools and their ability to help us pivot and also to help us with this sort of systems change. But the issues, there's some issues that are not getting enough attention. Who doesn't have access currently to digital tools? So let's put in that category, the poor, right? Informal and small businesses, women, youth. So I think we're not asking ourselves the right questions, enough of the right questions. What investments do we need to make and by whom to improve access? So to expand broadband investments, to expand access to handsets, to help defray the expensive airtime, all of these things. And I know this must be a common problem to education, health, other sectors. We've already alluded to it. My second point builds on this, the importance of the private sector. And so as we've said, the private businesses have really been key innovators, and they are the ones who've been able to rapidly pivot. Small and medium enterprises have been vital to the COVID response. But again, you know, these small and medium enterprises, these are the very ones who have trouble getting access to finance and other tools to help them manage risk that are critical to their development. Why is this? It's just expensive. It's so expensive to give sort of retail treatment to very small businesses. You can make a lot more money. It's much more profitable to deal with larger businesses. Ed knows this problem very well from his work at African Development Bank. So our challenge, which I think goes cross sectors, how do you use public sector policies and programs and donor resources to drive this kind of development that we wish to see? So it's relying on the energy of the private sector, but also putting a thumb on the scale so that the folks who are not included in the system right now get access. Okay, I see Johannes as a critical sign. Johannes, my last 3 bullet points, they really will be bullet points. Okay, other learning, right? The biggest way we can expand demand for nutritious and more environmentally sustainable commodities is to change consumer behavior. So we've seen during the pandemic, you know, enormous shifts in consumer behavior, right? Social distancing, the way that people get their food, et cetera, et cetera. So my thinking about this is how do we harness that knowledge about how to change consumer behavior and increase consumer demand for a different set of commodities. One of my colleagues, Lawrence Haddad, often says that our agriculture and food system is great at building demand for products that kill us, like sugary drinks and snack foods. So how do we turn that, again, with this sort of integration of public policy and private sector innovation? And so, Johannes, truly my last point here is I have been struck in the conversations about COVID, about how many times my colleagues are saying, you know, the COVID response has provided us with the real opportunity to talk to each other across sectors. Yeah, I mean, usually we dwell in our siloed worlds where health doesn't really speak to agriculture, doesn't really speak to education, but somehow, you know, the magnitude of the challenge has thrown us together. I heard the same thing from private sector colleagues, that all of a sudden they are seeing doors open to the government and doors open for conversations about dealing with the crisis, that just those conversations didn't happen before. So I think, you know, an important cross-sector lesson is for us to figure out how to keep those conversations going, keep those doors open, and not sort of default into our siloed selves. Thank you.
Sorry, Ed, your turn. I was muted.
All right. Thank you very much. I'll be brief because most of the key points have already been highlighted. I'll speak primarily to 2 key cross-cutting themes. That is the role of government and also the opportunities for digitalization. Let me start by looking at the allocation of budget resources. I was at in a public department at the African Development Bank that deals with sovereign operations. When the pandemic hit, we received numerous letters of request from ministries of agriculture to support projects designed to mitigate the impacts of COVID-19 pandemic on food systems. What I didn't know was that at the same time, similar requests were being sent from other sectors, especially health, education, and general budget support. Now, we only had very finite resources. We tried to find complementarities between some of the projects, but this was challenging. A good example of one of these complementary projects would be, say, you develop a school feeding program where you actually source all the food from locally produced food, therefore providing a market for SMEs. Now, these are very nice, beautiful examples, but I'd like to say they were more of the exception. It is really worth acknowledging that there is indeed a zero-sum game when it comes to allocation of public expenditure across sectors. Increased expenditure in health often implies that there's going to be a cut in agriculture or education. They have limited resources. Moreover, there's not a clear matrix that can help us prioritize where public resources are supposed to go to, because each of these sectors have outcomes that are not necessarily comparable. Moreover, neither governments nor development banks are really designed to work across sectors, as Julie was pointing out. This is a new way of thinking. Think of governments, development banks, universities, development organizations. What they have in common is departments and divisions. Think of that word for a second, divisions. The world has problems, COVID-19, and these silos that have been established over so many years are often very hard to break, as much as we want to. People still very much work within divisions and departments. However, the positive side on government involvement is that there is so much more that the government can do that does not require budget, that does not require money. Government has a critical role to play in creating enabling environments for policy and through policy and regulatory reform. These things can go a long way to unlock the potential that's in the private sector, and they can often be done with very minimal investment in terms of money. For example, increased interregional trade requires institutional policies, harmonized standards, regulations, and incentives that can optimize against trade. A big policy push that we had for COVID-19 was the creation of these green corridors that would ensure that trade in agricultural products was not disrupted due to border shutdowns. We had something called policy-based operations. The best way to explain these is they're kind of a quid pro quo when you say to a government, we're going to give you $100 million to support COVID testing in your country, but we require that you open and you lift all the barriers to agricultural trade, and you do certain policy measures in other sectors that don't require any money at all. So we did structure several of those kind of deals where we gave investment in one sector, but we required policy reform in another area. It's actually amazing to see this selective opening and closing of borders where governments would sit down and say, okay, we have enough rice, we're gonna close our borders to the export of rice, but we're gonna open our borders to the import of everything else. So we really had to sit down and try to convince governments that, you know, these things kind of cut both ways and you cannot be selective about it. The second point is really on the this digitalization. Now, Johannes, I know you don't believe in conspiracies, but if there was one out there, there's so many conspiracies on COVID-19 that's really put the blame on who stood to benefit the most from this pandemic. I'm kind of surprised that there's not any conspiracy around digital agriculture. Consider for a moment the following key events that took place in Q3 and Q4 of 2019 related to digital agriculture. The CTA Dalberg report on the digitalization of African agriculture report came out in September. The Montpellier panel released a report on Bite by Bite, policy innovations for transformation of Africa's food systems with digital technologies. The African Green Revolution Forum had a theme called Digital Agriculture, leveraging digital transformation to drive sustainable food systems in Africa. 74 ministers of agriculture signed a communique that was called Agriculture Goes Digital, Smart Solutions for Future Farming. I, in my division at the African Development Bank, we launched a new flagship called Digital Solutions for African Agriculture. This is all in 2019. Think of that alignment. So when COVID-19 hit in Q1 and Q2 of 2020, there was no sector that was better placed to take advantage of this big boom. It looks like all the building blocks had already been set in place. So starting around April of 2020, COVID-19 caused this surge in demand in contact-free service provision of in many sectors, including agriculture. So there was a huge pull from government, from private sector to deliver and usher out all these new digital solutions. Governments became more open, and in most cases, we were actually forced to digitize their services since people could not come in person. The big winners were, e-extension services, mobile wallet, remote sensing technologies, e-subsidies, and online marketplaces, to name just a few. Indeed, up to now, COVID-19 is accelerating the deployment of digital solutions to smallholder farmers. But as pointed out by Julie, governments and development partners have a role to play to ensure that the requisite enabling environment is put in place to reduce the widening digital divide between the rural versus urban, men versus women, literate versus illiterate. If we don't do that, they will create another bigger digital divide. Lastly, I should say, Johannes, I've been having this envy of, when I look at all the statistics in the health sector, these fancy graphics that you see on TV every day, it has really highlighted the dearth of actionable real-time data in the agriculture and food systems. We just don't have the high-level data that is actionable. In an era of big and instantaneous data, we are still making decisions in the ag sector based on data from 2017 and 2018. Ask yourself a question: how much wheat or maize is there in DRC? You go to FAO stats, you are likely to see data from 2018. Governments and development partners must invest in incentives to collect, report, and analyze critical data across agricultural value chains. Digitization presents a unique opportunity to do more of this with less resources. Thank you.
Thank you, Ed. Very interesting. Actually, your last point, data is real-time data in a crisis is obviously terribly important. And even I hear from my health colleagues that there are serious issues remain. I mean, just think about testing, even in this country, the US, even especially. So yeah, we now come to our last panelist, who's been extremely patient. Sarah Ruto, it's your turn to tell us about education and how you see the cross-cutting issues from where you sit in Kenya. Last time we talked, you were in your village outside of Nairobi. Today, I believe you are in your office, but tell us how do these cross-cutting issues in education look from your perspective when you grapple with real challenges on the ground in Kenya and beyond? Thank you. Sarah, your turn.
Thank you. It's raining here, and when it rains, everything gets affected. So I might put off the video if my voice starts disappearing. And it's also good to come last because everything has been said. So, as it were, and probably because of that, maybe you'll allow me, from the point of view that my day job is working in a Global South organization, but in my country, I also am the chairperson of the Kenya Institute the challenges that COVID brought. And then I was also asked to chair the COVID National Education Response Committee by our Ministry of Education. Okay, I have been told my voice is failing, so video has gone out. I hope I can be heard now.
Yes, you can be heard well, thank you. We miss your face, but you can be heard.
I am actually using two different types of sources. From my phone and the internet, but you can see this is failing, and maybe that's a good place to start with this whole aspect of digitization and the Internet of Things. I start with what seemed to have been a contradiction when I think of the Kenyan case, which is a country that wholly embraced M-Pesa. This is using your telephone for your financial transactions and things like that. But yet when you now moved on to the school and tried to introduce digital literacy, training teachers, you would have a bit of resistance from the so-called digital immigrants who would feel that, you know, you're disturbing them and they're about to retire and things like that. But I think COVID has sort of changed things. And I think we are going to see a little bit less resistance, and that digital literacy is here with us to stay. I suspect that going forth, what we are seeing in the reform process, using the example of Kenya, where we have an education reform going on, and there's a whole digital literacy program that was not very well received, I suspect people will begin to be a little bit warmer towards it, because during the 6 months when schools were completely closed in Kenya and even in the other areas, it was the digital space that allowed some sanity and allowed some sort of continuity for some children, definitely not all, as has been said. And so what we see in Kenya, for example, where digital literacy is one of the 7 competencies that is going to be stressed for education of the future, seems to be the right thing to do, and possibly will be one of the competencies to stress on. So hopefully we will also see more teachers registering for online courses. I think today Zoom and, you know, various webinars have taken root and changed the notion that we must see each other, you know, be in the same space for us to be trained and things like that, that perhaps we can embrace different forms of training. So these are good things going forth. So when I look at some of the wins, which have been stressed by the other speakers, that I'd like to also repeat, is that one of the things that struck me as really beautiful was the agility we saw both from the government and also from civil society in terms of responding to the fact that schools had been closed, but learning does not stop. Children still needed to be reached wherever they were. And so there was quite a bit of agility. And one example that I'd like to give from Kenya again is that it was the Communications Authority, for example, that reached out to us in the Kenya Institute of Curriculum Development to access content to the 40 or so community radio stations that they had. So you can see one different ministry reaching out to another ministry because they already had an infrastructure of setting up various government-supported radio stations. And these were to serve other purposes, but when it was needed for education, they reached out, and therefore we were able to give content for the radio programs. And many of these community radio stations serve some rural communities or very specialized, like urban poor groups. Like in Nairobi, in some places, they'll only listen to Ghetto FM. They speak in Sheng, they speak in the language that they understand. But what I'm stressing is the fact that there was this inter-ministry collaboration, you know, where an infrastructure had been developed, and then it was extended to education to support children to learn. So that agility happened in government. In the Kenya Institute of Curriculum Development, which has a long history of radio programs, it expanded the TV programs. The cloud also promised access to learning content, you know, at any place, anytime you want. One of the main constraints was, of course, cost. And again, the private sector came in, the technos, where they were able to offer bundles, you know, so that children can, with 50 shillings, I don't know how much that is in dollars, one can be able to get, you know, like 2 hours of time on internet bundles, which I think allowed children who would not have been able to access learning to do that. So I think that agility, that collaboration is something that got prominent, and hopefully one would like to see it happening more. The civil society organizations have always been very agile, and I see their effort to have been in allowing thinking. In Nigeria, for example, our partner there was invited by the Lagos Education Ministry to help think through, now that children are not going, what do we need to do? And together they were able to do surveys, support the ministries of education to conduct surveys, so that that information can be used to inform the various ministry efforts. And this agility of civil society organizations, that they can also bring in a little bit of money, a little bit of expertise to support, start off something, I think is something worth lauding. And we had also where you have far-flung communities. Last week, I went to a community in which you go with, on a vehicle until it stops because there is no road. And then after that, you have a foot bridge which you cross, and then for another hour, you now get onto a motorbike. And you go on that motorbike, and when you get there, you'll get a thriving community of about, I think it was about 2,000 households. It is a community that has a school, that has a dispensary, and you will find that the government has ensured there is a school, there is a dispensary, but the learning needs in this community are so huge that this is a place where civil society organizations then come in and support, as had happened in the case of Kenya. So where you have, therefore, civil society organizations, reaching out to the more vulnerable groups with more tailor-made options. And the tailor-made option here I'm talking about is that whereas the Kenya Institute of Curriculum Development had radio programs that are following the curricula, sometimes in these communities, they're a little bit behind the curriculum. And so you need some material or programs that can mediate and allow the children to learn to read, for example, before they can read now to learn. And organizations are able, civil society organizations were able to come up with responsive solutions during this time that were more hybrid, blended. So it is not just a digital e-learning solution, but one that combines also print that is airlifted to this place, supporting the teachers. A hybrid solution is sometimes what you will need to ensure that learning continues. And this is something that Jenny talked about in her presentation. And getting to this last mile of small communities will require that one has to pay attention to the context. And that is really important. And sometimes those contexts differ, and therefore you have to have different solutions. So one can think of scale in a different way, scaling of contextual solutions that speak to specific contexts. But perhaps the one thing that I feel is very important to stress at this point is that it is easy to scale something if the ingredients of scale were already inbuilt. I think a major problem that we see is that good things are often, done that are speaking to a specific solution, but they were never designed for scale. And so even if one has a different community with a slightly different issue, because something was not designed for scale, the ingredient was not there, it becomes very difficult to expand it. So it is really, really important to have the right ingredients of scale, and that makes it easy to expand. An example I will give is based on the work that we do in the PAL network, where we do household-based assessments. And one of the things that we have done is to invest in building and identifying community structures that then allow you to invest in the citizens, work with the citizens, and when something needs to be done, it is through the citizens who have a local knowledge of the particular area. And it becomes very easy for these same citizens to then grow something because there is already a resource structure and basis that one is building on. So during this COVID time, I think in terms of digitalization, we saw a lot and agility that is worth lauding, both from government side as well as civil society organizations. And the civil society organizations often reached the places that were had less equity issues, children who are further left behind, and it therefore is a public-private partnership that needs to continue. I think the gaps that we have seen have been shared by many of the speakers, but I'd like to speak to the fact that the digital solutions are pretty expensive. They're unevenly distributed, like the infrastructure is unevenly distributed. In Kenya, the arid north is really, really behind. Somebody needs to do something. Otherwise, the haves will continue to have it and the have-nots will continue not to have. In some of these areas, even having just radio signals was not easy. And therefore, even if there was a radio program, children could not get it because there was just no signal. And I think I'd like to specifically point the children with special needs. For example, in Kenya, through the digital literacy program, we have gadgets for visually impaired children that are in schools, and children were at home. And so, you know, this was something that could have been done earlier on. I've seen Johannes back. Is my time over?
Yes, give it another 1 or 2 minutes and then we'll turn to Q&A.
All right. Then I spent too much time on that. I think I'd like to also say that one of the things that I saw that has been very useful and hopefully will continue is that the partnerships we saw across various sectors, like in the working committees you have people from the telco seated there, people from the health seated there, people from the interior, the provincial administration seated there. I did not work with anybody from agriculture. I'm not sure why, but maybe this is something that can be done. So this collaboration and avoiding the silos, as others have spoken about, is something that hopefully could continue. The last thing that I'd like to talk about is the communication from the health colleagues in Kenya has been remarkable. They speak in a simple language, they practice repetition for effect, and I think this is something that other sectors, like in education, will perhaps speak too much, and sometimes the key salient points are lost, which I think is something that we could learn and improve on. Thank you, and I'll hand over back to you.
Wonderful, thank you very much. This was just such a rich set of presentations and observations from our panelists. I'm looking at my chat box here and I see one question which I will pass on in just a minute to actually our agricultural team, but I would love to see more questions if there are any. If not, there's probably more we can say on our side. I have some actually overarching comments which I can share, but we would really like to hear from you. We have about 15 minutes left in total, so there's time. But while you all think about possible comments or questions, let me pass on the one that Florence Reed from Sustainable Harvest International passed on to us. And she sort of talks from her experience with 3,000 smallholder farmers in her program, I think mostly in Central America. And she asks, so do you see a shift as a result of the pandemic from farming of export crops dependent on external inputs to a focus on agroecological practices that produce a healthy diet for farm families and local markets, eliminating rural families' dependencies on money to get food since they produce it themselves? This actually links up maybe with a comment that Julie made. I leave it maybe up to Julie and Ed to respond. Maybe Ed, from your perspective at the African Development Bank, did you see a shift of this kind of happening? And should it happen, perhaps even more? Is it a good idea? Does it need more support perhaps? In some sense, it sounds almost like we might go back to a more efficient sort of form of basic agriculture that we used to have. So Ed, do you want to comment on, and Julie, if you want to join for briefly?
Sure. I mean, first of all, that's actually a very fantastic question, and it's a one that's getting quite a lot of traction in the discussions. So I would say maybe the initial natural instinct here is to support localized food systems as a way of adapting to these kind of shocks. When the less the food has to travel, you have a sense that within that there might be a little bit less susceptible to these shocks such as COVID-19. So there's been a little bit of a push to having a little bit more of that local production and self-sufficiency. But one has to follow that with a caution that says, look, the comparative advantages of producing food are different. Pushing for self-sufficiency in local community is not always the solution. You will find that most foods that are produced in one region are consumed in a very different part of the country, or even in a different country altogether, depending on comparative advantage. So there has to be a balance here where certain key foods and staples might be produced locally, but there's still room and scope for having this continuous flow and trade that allows for comparative advantage and all the key benefits from trade. So it's not as a clear an answer as maybe you would like to hear, but there is somewhere in between that extremity of let's be as locally sourced as possible and let's rely entirely on exports. I think the pendulum is swinging a little bit better and closer to the localized food systems.
Thank you, Ed. Julie, do you want to add anything from your earlier point that you made about, I think it was you, about
Sure.
different food systems, and is that link up with what Florence was saying?
Great. No, and thanks, Florence, for that question. I think it's too soon to know, what kind of shift has really been occasioned by COVID-19. So as Ed was telling us, our data systems are not at that state yet, but it'll be interesting to track, what I think increased interest in shorter supply chains and increased systems in sort of more proximate food. So Johannes, I want to comment a little bit on what you said earlier about a return to subsistence farming systems. I don't think this is that. Yeah. So I mean, I see the discussions partly prompted by COVID-19, but also Ed mentioned the upcoming UN Food Systems Summit and the discussions about agriculture's role in climate change and the need to sort of think differently about soils, for example. So that's really sort of taking us into a new generation of agroecological practices that I think Florence knows this very well. Yeah, I mean, draw on some of the past practices, but also are very scientifically informed, and also draw on a lot of increasing availability of spatial data, exciting developments even in being able to look at soil constraints with data and do sort of on the spot diagnosis. So I think it's exciting, but it's very important not to say that we're going back to subsistence agriculture, because I think there are really important commercial opportunities, but it's going to look different, I think, than what we see now. It's not so homogeneous, but heterogeneous. Thank you.
Thanks, Julie, and Florence, thank you for your question, comment. We have about 10 minutes left. What I want to do, first of all, is sort of abuse my time as the moderator to share with you what I sort of preliminarily take away from this discussion. Then if there are no more questions, I will, if we have time left, turn back very briefly to the panelists and sort of ask each of them to make maybe one brief observation of one takeaway for each of them, and then we'll come to closure. So as I said, I'm using my control of the microphone here. I have the following thoughts as I've listened to all of you panelists. Obviously, first of all, the scale of the crisis and the impact of the crisis and the challenge of recovery is huge. So we really, really have to focus systematically on the scale of the response, and particularly the scale of impact that we achieve through our response. And I think we made a little bit of a dent in identifying a set of questions that we need to address, and some lessons here. Among the general lessons, first of all, I think, and it reinforces the need for opportunities like the community of practice that we're now meeting as, is the opportunity to talk across sectors, and that silos, if they persist, are a serious problem. And each of you actually in your comments, I think, reinforced that notion that really, really, really we have to learn across and reach across the silos. Second general comment is that resilience, adaptation, agility, iterative approaches, and so on are obviously essential for an effective crisis response, but I also took away from your comments that these will be critical as we rebuild better. The good news is that at least during the crisis situation, government, civil society, the private sector, hopefully also the donor community, has actually shown quite a bit of agility and ability to adapt relatively quickly. So let's build on that and not lose that agility as we go hopefully beyond crisis sooner rather than later. The need to leapfrog, change behaviors. And I think to, in fact, leapfrog will mean change in behaviors. Some of this already happening again as part of the crisis, but are we all going to go back to our old behaviors and basically stop jumping instead of leapfrogging? A very interesting potential tension that I heard, on the one hand, democratization as a result of the crisis, but at the same time, exclusion and much greater vulnerability, and the vulnerable being much more vulnerable than the not so vulnerable. So democratization great, but exclusion of the most vulnerable and the impact on the most vulnerable being, in fact, a serious problem which we really all need to pay attention to. New ways of doing business, that links back with resilience, adaptation, and iterative approaches. But I think in each of these areas that we discussed, we actually saw that new ways of doing business are coming online, whether it's agricultural production, which we heard about, education, health, and so on. And of course, digitalization will play a major role here, but it's not just digitalization. The importance of real-time data, again, really important. Now, there's some advances that I think we're making. We just heard from agriculture. Health is doing relatively well. Education may be doing less well. But you can't respond to a real crisis if you don't have real data. And post-crisis, again, if we want to build back better, we better know against what reality that we're facing, we're doing that. And finally, in terms of the major cross-cutting lessons, I took away that we need to find better and pay great attention to contextual solutions. In food and education and health, general across the board solutions will not help. In scaling up, we need to have to pay a lot of attention, not just to whether an RCT has told us that something will work, a randomized controlled trial has told us that something will work, but we also have to pay attention to the enabling factors that will vary from context to context that allow you to respond at scale. And so whether it's the policy environment, whether it's the fiscal and financial instruments that you have, whether it's the political environment, whether it's the institutional context, the types of partners you can engage, all of these are contextual factors that we have to, in each context, assess and tailor our solution to, or try to change if we have the ability to change the system in which we operate. So from my perspective, this focus on contextual solutions or solutions in the context in which we operate is very important. My last set of comments is around the 5 areas that we had pre-identified as being potentially sort of focal areas, or 6 areas for cross-cutting attention. I think it's clear to me anyway that the impact of women on women, children, and the most vulnerable deserves very special attention everywhere and for all sectors. Digitalization obviously is critical as a challenge in terms of using it effectively, but as an opportunity also, a great opportunity moving forward. the trade-offs and the tensions in budgets are real. And let me link that to a point we actually have talked very little about it. I was quite surprised we didn't hear more about, namely the need for donors, the need for the international community to not only help itself back in their home countries and especially in the OECD countries, but also be as generous and as effective in providing stimulus support with their development partners. And so I see there a link between budgets and the role of international community. Fortunately, some of the MDBs have been quite proactive in accelerating their engagement and this commitment and disbursement of resources. But my hunch is we need to do a lot more, including very much in this country as we, in the US, as we look at our actions in response to the crisis. And finally, yes, the private sector, of course, plays an important role. We heard especially the role of SMEs, small, medium enterprises, the role of the informal sector, and as coming back to the question, of course, that was raised by Florence, the whole, in the agriculture sector, it's, of course, the smallholder farmers that are critical to the recovery and the effective response as we go forward. With this, let me see, we have about 3 minutes left. Is there anybody from our panelists who wants to have one more word? Open up your screen if you want to just throw in a last sentence. Nope. I guess Julie. Okay.
Yes, thanks, Johannes, for that great summation. I think those points on thinking about context and thinking about resilience are the ones that really stand out for me from today's discussion. And I want to point us towards the rest of the discussions we'll be having this week and next week. I think that the issue that we face is how do we measure progress in those areas? How do we measure progress and whether we are taking the context into account and whether a system is more or less resilient? I think we all know that you manage what you measure, and part of that is how we've sort of gone down the path of maybe too much focus on gadgets. I think Jenny mentioned that early. So if we want to sort of step back and take a more contextual view and a systems view, how will we know we've progressed? That's all.
Great. Thank you. Anyone else? No? Well, then I have two more quick closing items to mention. First of all, I hope those of you who stayed with us, and there are about 80 to 90 of you out there who joined us today, please also join us for the upcoming plenary sessions tomorrow morning and on Friday morning, and for the separate sessions by each of the 9 working groups of our community practice next week. If you're not already registered for these sessions, that's the working group sessions in particular, it's not too late. You can do so on the workshop website until Friday. And finally, we plan to summarize the proceedings of all workshop events in the next newsletter of our Scaling Up Community Practice. And we will also in that newsletter invite you to share your feedback with us so that we can organize future workshops in an hopefully even more exciting and productive way. We also hope to host the videos on the website that we will launch on the 30th of October. So if you missed anything or you want to direct some of your colleagues to a particular workshop event, you will find it on the website. With that, I thank you all for staying with us. I thank our wonderful panelists for their extraordinarily insightful and exciting contributions. And I wish you all a great week, a great day, and hopefully we'll all stay safe and healthy and do our jobs. Take care. All the best. Thank you.